So in summary, I think HER2 Climb was a huge success. I think it's very valuable for all HER2 positive metastatic breast cancer patients, not just those with brain metastases. But the population with brain metastases is clearly something we're very interested in. We have a lot of agents in our HER2 positive repertoire, but not a lot of them cross into the blood-brain barrier. And we know for the 50% of patients that will develop brain metastases that they need active regimens in this space. The other thing that I think is worth mentioning about the HER2 Climb trial is the patients that they allowed on trial. This was very different than historical patients that were allowed on a clinical trial with brain metastases. Historically, we allow patients that have had treated and stable brain metastases. HER2 Climb not only included those patients, but they also included two additional populations: patients that had untreated brain metastases and patients that had treated brain metastases and were subsequently progressive. So it was really a quite high risk, if you will, patient population. And I hope that other clinical trials, other drug companies, other people developing drugs in this space will take note of this and include more patients on clinical trials with other groups of brain metastases as well.
So I think there's a lot of important further research that we can do with tucatinib. I'm really excited about the trial ongoing HER2 Climb 02, which is another randomized study that includes patients with active brain metastases, evaluating the addition of tucatinib to TDM1. I'm also looking forward to potentially seeing this drug moved up into a curable patient population. We know from the Catherine study that the use of adjuvant TDM1 in patients who did not achieve a PCR with a neoadjuvant HER2 targeted therapy in combination with chemotherapy did not really alter the incidence of CNS metastasis. So studying the addition of tucatinib in a curable patient population who may be at high risk for development of metastatic disease really makes sense and may make a difference in outcomes of these patients. We're also evaluating tucatinib in combination with capecitabine and trastuzumab in patients with leptomeningeal disease in an ongoing study through the Translational Breast Cancer Research Consortium. And so given this drug's ability to cross the blood-brain barrier, we're hopeful that it may be able to help improve outcomes for patients with leptomeningeal disease who generally have a poor prognosis and limited treatment options. Finally, there's a lot of other innovation and research efforts underway to further target HER2 positive breast cancer. And some of the agents which I think are most exciting include immunotherapy, for example. There's currently an ongoing phase 3 study underway evaluating the addition of atezolizumab to trastuzumab and pertuzumab and taxane in the first-line setting through the NRG. Additionally, there are other novel HER2-targeted agents. For example, ZW25 is a interesting agent. It's a biparatropic antibody, which means it's capable of binding to 2 different epitopes of HER2 and is also currently under study in various different clinical trials. So I think there's a lot more research and a lot more drug development to look forward to in the future.